Hi, this is Rachel Chamberlain doing the presentation on lung cancer. Lung cancer, it forms in the tissue of the lungs, normally in the linings of the passageway, like the alveoli, the bronchial tubes. And there are two different types of lung cancer. There is a small cell lung cancer or a non-small cell lung cancer. The main difference between the two is just how big the cancerous cells are. So small cell lung cancer is a fast-growing, fast-spreading cancer, and it usually occurs in smokers, not so much non-smokers. It starts in the bronchi, and it moves quickly throughout the rest of the body. Non-small lung cancer. This type of cancer affects smokers and non-smokers. It is a group of cancerous cells that act similarly. For instance, squamous cell carcinoma and adenocarcinoma. The etiology of lung cancer, it started in the mid-1800s after the cigarette wrapping machines were developed. It never really took off until after World War I and in the between 1950s and 60s. The average person smoked 4,400 cigarettes per year within that time frame. In 1964 is when the Surgeon General told cigarettes they had to make a caution label because they had found out that it was part of the reason that was increasing the risk of lung cancer and making things worse. Some of the risk factors of lung cancer is smoking. The number of years and amounts of cigarettes you smoked will definitely impact that, and if you quit, the sooner the better type of deal. Exposure to secondhand smoke, it's not necessarily always your fault, but it is an increase of risk. Exposure to radon gas, and it is produced naturally and can be found in homes, and that's part of the reason you are supposed to get checks for that. Exposure to asbestos and other carcinogens, which is mostly workplace exposure to asbestos, arsenic, chromium, and nickel. Those are the top 4. Or a family history of lung cancer, mainly if a parent, sibling, or child has been diagnosed with it, then you should be tested too. Some of the symptoms include, symptoms generally don't start until later in the cancer. Cough that won't go away, coughing up blood, shortness of breath, chest pain, hoarseness, losing weight without trying to, bone pain, headache that you just can't get rid of. Diagnostic testing. Imaging tests, x-rays can reveal an abnormal mass or nodule. A CT can reveal small lesions. They are both important, and you will most likely have to get both just in case. And sputum cytology, coughing and producing sputum, which is just another word for mucus or phlegm. And having a doctor look at it underneath a microscope can sometimes reveal a lung cancer cells, but it's not always, or a biopsy. There's a bronchoscopy, which is a tube passed down your throat into your lungs, and it gets tested that way. Mediastinoscopy, which is an incision in the neck, and surgical tubes are inserted behind the breastbone to take samples from lymph nodes and test those. Or there is a needle biopsy, which is using imaging testing to insert a needle through chest wall and into lung tissue. This is where those x-rays and CT comes in handy. Treatments. There's surgery. There's 4 different types of surgery. There's a wedge resection, which is removing a small section that contains the tumor along with some healthy tissue to make sure it's all taken out. There's segmental resection, removing a large portion of the lung but not the entire lobe. Lobectomy, which is removing the entire lobe of lung. The 4th type of surgery is a pneumonectomy, which is removing an entire lung. There's also chemotherapy, which is using drugs to kill the cancer cells. It is generally a combination of drugs over a span of weeks or months, with breaks in between to help recover from the side effects that it will produce. And it can be used before surgery to help shrink a tumor so the surgery can go smoother. There's also radiation therapy. That is high-powered energy beams from X-rays and protons to kill the cancer cells. And it is oftentimes combined with chemotherapy treatments to help make sure the effectiveness is fully there. There is also radiosurgery, which is intense radiation treatment that aims beams of radiation directly onto the cancer cells and kills it that way. Normally it's not just one beam, there are several beams, and typically only one or very few treatments are needed if this treatment is the one that is chosen. There's also targeted drug therapy, which focuses on specific abnormalities with the cancer cells. So if it has mutated or whatever. And it's typically reserved for those with recurring cancer or advanced cancer because they're more than likely the ones with the abnormalities. There's also immunotherapy, and it uses the body's immune system instead of, it tricks the immune system into targeting its own cells instead of just letting the cancer cells live. And it's generally only reserved for those with advanced cancer. In palliative care, which is just minimizing your symptoms, and that has been proven to actually help improve your life span, because if you feel well cared for, then you're more likely to want to live, so you will fight harder and make your body fight harder. And those are my sources. Thank you for watching.